Bipolar disorder, also known as manic depression, causes extreme shifts in mood. On one extreme are the highs of mania, and on the other extreme are the lows of depression. Unlike ordinary moods, good or bad moods in bipolar disorder last for days, weeks, or months, and the mood changes are so intense that they interfere with the bipolar person's ability to function normally. During the manic phase of the illness, a person will possibly make impulsive decisions, spend outrageous amounts of money, or find it impossible to sleep for more than a few hours. During the depressive phase of the illness, the same person might not be able to get out of bed and feel full of hopelessness. Although the causes of bipolar disorder are not known, the disease often runs in families. The first episode usually occurs in the teenage years or early adulthood. The symptoms can be hard to diagnose, so many people with bipolar disorder are misdiagnosed. With proper treatment, those with bipolar disorder can lead a normal life. The symptoms of bipolar disorder can vary widely in their pattern, severity, and frequency. Mania symptoms of bipolar disorder are the exact opposite of the depressive symptoms. Mania can make a person feel invincible, while the depression can make them feel defenseless. The signs and symptoms of bipolar mania. In the manic phase of bipolar disorder, feelings of heightened energy, creativity, and euphoria are common. People experiencing a manic episode often talk a mile a minute, sleep very little, and are hyperactive. People experiencing a manic episode may feel like they're all-powerful, invincible, or destined for greatness. Mania feels good at first, but spirals out of control. People experiencing mania may behave recklessly, gambling, having inappropriate sex, making foolish business investments, or many other reckless behaviors. People in mania may be angry, irritable, and aggressive. Some people experiencing mania become delusional or start hearing voices. Common signs and symptoms of bipolar mania include feeling unusually high, optimistic, or extremely irritable. Unrealistic, grandiose beliefs about one's abilities or powers. Sleeping very little but feeling extremely energetic. Talking so rapidly that others can't keep up. Racing thoughts, jumping quickly from one ideal to the next. Highly distractible and unable to concentrate. Impaired judgment and impulsiveness. Acting recklessly without thinking about the consequences, and delusions and hallucinations in severe cases. The signs and symptoms of bipolar depression. Growing research suggests that bipolar depression is significantly different than depression when it comes to the recommended treatment. Most people with bipolar depression are not helped by antidepressants, which can actually make bipolar disorder worse, triggering mania or hypomania. Although there are similarities, certain symptoms are more common in bipolar depression than in regular depression. Bipolar depression is more likely to involve irritability, guilt, unpredictable mood swings, and feelings of restlessness. People with bipolar depression move and speak slowly, sleep a lot, and gain weight. People with bipolar depression are more likely to develop psychotic depression, a condition in which they've lost contact with reality. People with bipolar depression are more likely to experience major disability in work and social functioning. Some of the common signs and symptoms of bipolar depression include feeling hopeless, sad, or empty, irritability, inability to experience pleasure, fatigue or loss of energy, physical and mental sluggishness, appetite or weight changes, sleep problems, concentration and memory problems, feelings of worthlessness or guilt, and thoughts of death or suicide. The treatment for bipolar disorder. Bipolar disorder requires long-term treatment. Since bipolar disorder is chronic, relapsing illness, it's important to continue treatment even when you're feeling better. Most people with bipolar disorder need medication to prevent new episodes and stay symptom-free. The most effective treatment strategy for bipolar disorder involves a combination of medication, therapy, lifestyle changes, and social support. Self-help for bipolar disorder includes: number 1, get educated. Learn as much as you can about bipolar disorder. The more you know, the better you'll be at assisting your own recovery. Number 2, keep stress in check. Avoid high-stress situations. Maintain a healthy work-life balance. Try relaxation techniques such as meditation, yoga, or deep breathing. Number 3, seek support. It's important to have people you can turn to for help and encouragement. Try joining a support group or talk to a family member or a trusted friend. Number 4, make healthy choices. Healthy sleeping patterns, eating, and exercise habits can help stabilize your moods. Keeping a regular sleep schedule is particularly important. Number 5, monitor your moods. Keep track of your symptoms and watch for signs that your moods are swinging out of control so you can stop the problem before it starts. The symptoms of bipolar disorder can vary widely in their pattern, severity, and frequency. Bipolar mania leaves a person spiraling out of control, while bipolar depression leaves them feeling hopeless. The treatment involves medication, good eating and sleeping habits, and therapy. With the help of treatment, a bipolar person can live a completely normal life.